The Philippines is one of the progressing countries to healthcare systems. Our healthcare may not be the best, but improvements in services are evident over the past years. And the promising robotic surgery is one of our current advancements in the country. Today's objectives are to introduce the importance of robotic surgery, differentiate its advancement from other surgical procedures, enumerate its advantages and disadvantages, and improve your state of awareness regarding the topic. Before the discussion, kindly pause and scan the QR code for our 6-item activity. It will measure your familiarity and current knowledge regarding the robotic surgery. Before anything else, I would like you to ponder on these questions. Are you familiar with the 3 basic surgical procedures? What is robotic surgery, and is it already available in the Philippines? Do not worry if you are uncertain about your answers. I'll do my best to help you answer those questions as we go along the discussion. So, what are the 3 basic surgical procedures? First one, we have the open or traditional surgery. It is a surgery where it opens up a skin or tissue so the surgeon will have a clear view of a specific body part or area subject to an operation. This procedure uses traditional materials like scalpels, scissors, forceps, retractors, and etc. The second one, we have the advanced laparoscopic surgery. It is considered as minimally invasive surgery that uses enhanced equipment. Compared to traditional surgery, advanced laparoscopic surgery uses a camera that allows the surgeon to view his procedure through a TV monitor. And then lastly, we have robotic surgery. Similar to advanced laparoscopic surgery, both only require small incisions, but it is more enhanced because of the equipment or technology used during the procedure. To give you a more in-depth knowledge, robotic surgery or robot-assisted surgery. It is one of the promising and latest products of science and technology in the field of health and medicine. It is a minimally invasive surgery that requires small incisions compared to traditional or open surgery. That is also why it is said to have more benefits and advantages compared to other surgical procedures. It uses advanced equipment called the Da Vinci surgical system, controlled by a well-trained surgeon seated on his console in performing surgery with its robotic arms. All the equipment needed, including the camera, is already attached to it that can move freely and is stable inside the body compared to bare hands. Now the question is it already available in the Philippines? The answer is yes, it is. December 31, 2010, the medical city in Pasig is the first to adopt robotic surgery in the country. It was followed by St. Luke's Hospital on July 12, 2017, performing its first transoral surgery. And the recent one is the UPPGH, April 29, 2019, where it is the first government hospital in the Philippines to perform surgery using the Da Vinci surgical system. Now that we are aware of the basics of robotic surgery, let us now focus on the question, why is it promising? And what can it offer to both people and healthcare workers? To help you reflect on those questions, I will present their advantages and disadvantages. It is an advantage for healthcare workers because of this technology that performs an efficient and at the same time effective surgical procedure. While for the patient, it is more on the benefit parts of the small incisions and minimal wounds made by the operation. With that being said, like any other technology subject to any malfunctions, robotic surgery is not an exception to that. And some of its disadvantages also are its cost and high maintenance. Robotic surgery has been an interesting topic to me. In the last academic year 2020 to 2021, I conducted a research study regarding the people's state of awareness and acceptance of the said surgical procedure in my province, Bataan. My journey in conducting my research on robotic surgery was tough and rough, but for me it was fulfilling, especially when I won the best research paper for that academic year. Now, I am back with this topic because I wanted to emphasize that if you were not aware of it before this discussion, it is normal and it is okay because I have been there. But now, join me as we speak and push for development in our healthcare system, and let us all progress as citizens who value health and quality care. Robotics is only one of its components, but we are fighting for our one field, health and medicine. Before I end, feel free to scan this QR code for our post discussion. Test ourselves if we have gained knowledge from this short lecture. Lastly, I acknowledge all the references to this content. This lecture is dedicated to all the frontliners out there. My dear viewers, and to all the frontliners, thank you and keep well.